Welcome to Joint Camp. In this video, we will be discussing how to prepare for your upcoming joint replacement. Please refer to your joint replacement binder for more detailed and important information related to your joint replacement and recovery. Please remember, you are personally accountable for at least 50% of your final outcome. It is your responsibility to help achieve your goals and expectations. Your recovery is all about what you do to keep moving. Your joint will be better than it was before surgery, and it will need your personal touch to fully recover. In the weeks leading to your surgery, there are many things you can do to help with your recovery. This starts with exercise, healthy eating, managing weight and diabetes, and to stop smoking. Exercising helps to improve strength after surgery. This can be as simple as starting the post-operative exercises prior to surgery. Eating a healthy diet before surgery helps to ensure proper nutrition for healing after surgery. Healthy eating also helps with proper management of weight and diabetes. Your BMI, body mass index, needs to be 40 or less to proceed with joint replacement surgery. Your hemoglobin A1C needs to be 8 or less. This criteria are important for proper recovery and healing after joint replacement. If you are a smoker, you need to stop smoking 6 weeks prior to surgery. This is true for any nicotine products. If you need assistance with meeting these goals prior to surgery, please contact your doctor's office and have referrals set up. It is important to meet these criteria to promote healing and to reduce the risk of infection. You will meet with a member of your anesthesia team approximately 2 weeks prior to surgery to discuss options for anesthesia for surgery as well as pain control after surgery. This consultation will be scheduled with you at the time of scheduling surgery. If this appointment has not been set up for you, please call your surgeon's office to make this appointment. There are some medications that should be stopped 1 to 2 weeks prior to surgery. If you take any medications to thin your blood, be sure to speak with your primary care provider regarding when to stop these medications. Medications such as ibuprofen, naproxen, aspirin, Advil, Aleve, and fish oil need to be stopped 7 days prior to surgery. Before surgery, please refer to the list of medications to stop located in your surgical folder. There are also medications we encourage you to continue to take until the time of surgery, including the day of surgery. We would like patients to continue taking medications for high blood pressure, heart, seizures, and diabetes as directed by their primary care physician. Please start taking an iron supplement 2 weeks prior to surgery. This will help to reduce your need for blood transfusion after surgery. Preventing surgical site infections actually starts before surgery. Most wound infections are from bacteria we carry around with us or encounter in our environment. To reduce the risk of post-operative infection, we have a few things that need to be completed. Starting 2 days before surgery, we ask that all bed linen, towels, and clothing that you will be using before and after surgery be washed. If you have pets that normally sleep with you, we ask that they not sleep with you as it increases your risk of infection. You will also need to begin showering with the Hibiclens soap provided by the clinic for your surgery. If you do not receive any soap, please contact the clinic to obtain the Hibiclens soap. You will need to take 3 Hibiclens showers prior to surgery. You will take your first shower 2 nights before, the next shower the night before, and the last shower the morning of surgery. For example, if your surgery is on a Monday, you will need to shower Saturday night, Sunday night, and Monday morning. There is a laminated copy of instructions in your surgical folder for you to take into the shower as a reference guide. Before showering, assemble your supplies. 1 bottle of Hibiclens, 1 clean washcloth, 1 clean towel, and clean clothing to put on after your shower. Wash your hair, face, and genitalia using normal shampoo and conditioner and soap first. Make sure you rinse the shampoo and conditioner and soap from your hair and body thoroughly. Turn the water off in the shower or move away from the shower spray. Apply an entire bottle of Hibiclens to a wet, clean washcloth and lather your body only from the neck down. Never use the Hibiclens on your face or genitalia. Gently wash your entire body, starting on the surgical site, for about 3 minutes. Once you have completed the scrub, turn the water back on or move back into the spray and rinse the Hibiclens off your body completely. Do not wash with regular soap. This will activate the antimicrobial action of the Hibiclens soap. Pat yourself dry with a clean, freshly washed towel. Do not apply any powders, deodorants, or lotions. 1 to 2 business days prior to surgery, a surgical nurse will call you regarding your surgery arrival time. Due to variable patient needs, it is difficult to provide arrival times more than 2 days prior to surgery. Your arrival times will be 1 to 2 hours prior to your surgical start time. This allows the medical team time to prepare for your surgery. Please keep in mind that surgical start times are calculated by estimating standard lengths of surgery. Surgery lengths can vary greatly from person to person depending on anatomy and needs. When you arrive, the surgical team will keep you informed of the time delays. The team does their best to respect the surgical start times you were given, but unforeseen delays can happen in the procedures that are scheduled before yours. We apologize for any delays that may occur. You will be instructed on when to stop eating and drinking prior to your surgery. Typically, we ask that you stop eating and drinking before midnight prior to surgery. However, if your surgery is scheduled for afternoon, those times may be altered. You can brush your teeth the morning of surgery. Do not swallow any water or toothpaste. If you were instructed to take your morning medications, you may do so with a small sip of water, just enough to get your pills down. We request that all jewelry, artificial nails, nail polish, or hairpins be taken off and left at home prior to surgery. Artificial nails and nail polish can contain bacteria which may increase your risk of postoperative surgical site infections. It also makes it difficult for our OR staff to check your oxygen levels during surgery. We ask that hairpins be removed because the cautery used during surgery can result in burns where any metal is touching your skin. When you arrive at Bluff Medical Center, you will need to register at the front desk. Once registration is complete, they will direct you to the surgery department. Once in the surgery department, you will be escorted to one of our day surgery rooms where a nurse will get you ready for surgery. You will be asked to change into a surgical gown and clean your operative site with a special cloth. The nurse will go over admission questions and start your IV. The IV will be used to give you medications for surgery along with antibiotics to prevent surgical site infections. The nurse will apply special stockings to your non-operative leg to help prevent blood clots during and after surgery. You will also have a special iodine solution applied to the inside of your nose prior to surgery. This is to help get rid of any bacteria that may increase your risk of infection. These bacteria are known as MRSA, which is a superbug that likes to live in our noses. Usually it is harmless, but given the right conditions, it can cause a serious infection. The iodine solution will help to eliminate this bacteria. You will also receive preoperative pain medication as discussed with your anesthesia provider at your appointment. These medications are taken prior to surgery to help with pain control after surgery. The nurse will also set up ORI, a text messaging service, for your family and/or friends to receive updates throughout your surgery. These text messages will go to the family and friends you wish to receive them. Once you are ready for surgery, you will be taken to the recovery room to receive your nerve block. Once your nerve block is completed, you will be taken to the OR suite. Warm blankets will be provided as the OR suites can be chilly. While in OR, we will keep your family updated as to your progress through the text messaging service. After surgery, you will be brought back to the recovery room where your heart rate, blood pressure, and oxygen level will be monitored every 5 minutes. You may also have blood drawn and a post-operative x-ray of your new joint. We will continue to update your family throughout your time in the recovery room as well. Once you are able, you will be moved out to your room in acute care where you will finish your recovery. Please be sure to review your joint camp binder for more detailed information regarding your surgery. If you have any questions, please contact your surgeon's office. Thank you for choosing Mile Bluff Medical Center. We look forward to serving you through your joint replacement journey.